and if members can do the necessary with any electronic devices. There's apologies from Mr Patsy McGlone and Mr Sidney Anderson. The draft minutes of the meeting on the 3rd and 8th of April are available. Members content with their accuracy and sign them accordingly.
Good. Well, 6 is yes. Golf.
Is it there? Two matters arising. There's responses from the Minister for Social Development and the Minister for Education around the Human Trafficking Bill. DSD Minister has responded to committee's request for views on proposed new clause 10A. A copy of the Minister's responses on page 12 of the table pack, and a copy of the Education Minister's response has been circulated at this meeting. It should be available. The committee has also written to the Department of Health and may wish to consider the matter further when this response has also been received. It's too late to include any of these letters as part of the committee report on the bill. Item 2 is a response from the Department of Finance personnel regarding forced marriage. Lord Morrow advised the committee he had written to the Minister regarding a request from the Finance Minister to include a new offence of forced marriage as part of the Human Trafficking Bill. The committee briefly considered this proposed new provision at our meeting on the 13th of March and agreed to request a briefing paper from the Department of Finance on the background to and rationale for the new offence and the wording of the draft clause. A response has been received from the Department of Finance and personnel advising that a draft clause has not yet been produced but does set out the background to and detail of corresponding provision in Great Britain. A copy of that response is in the table pack. As is the case with the letters from the Ministers of Social Development and Education in respect of new clause 10A of the bill. The committee may wish to consider these in further detail. However, again, it's too late to include it as part of the report. Item 3 is the draft forward work programme. If members are content to note it, it's on pages 23 to 32 of the tabled pack. An informal planning meeting will be held on Wednesday the 30th of April, which is prior to the committee's first meeting after recess. So if members are able to attend that would be helpful. I'm going to come back to item 4, which is the report currently still being finalised. As I'm sure members appreciate, it was Tuesday we agreed it, and the committee staff have been putting in marathon shifts and we're almost there, but it's just being printed off, so we're going to move straight now into the prison reform programme, and then we will take the human trafficking bill, get the next presentation, and then we'll do the final agreement of the report. So let me welcome Sue McAllister, Director General, Mark Adams, HR and Organisational Change Manager, Paul Cackwell, Director of Offender Policy and Operations, and Brian Hockey, Director of Rehabilitation of the Northern Prison Service. You're all very welcome. Thank you. And as usual, we'll record this on Hansard, and then that'll be published in due course. So at this point, Sue, I'm going to hand over to you.
Thank you, Mr. Chairman, and thank you for your welcome. I'm sure that members will have questions on a range of issues, and I therefore don't intend to make a long opening statement. We're grateful for this opportunity to brief you today. While we're here to discuss the reform of the prison service, we will, of course, be happy to take any questions you may have. Members may be aware that the Criminal Justice Inspectorate has today published a report into the work of the Prisoner Escorting and Court Custody Services, known as PECS. The Inspector has highlighted the exceptional work that has been achieved by PECS since the previous inspection in 2010. I would agree with Sir Ginny that this report and the progress in PECS is a beacon to all parts of our service on what can be achieved through effective local leadership, through partnership between management and staff, and through progressive and productive relationships with the trade unions. Mr. Chairman, we would also like to give you a brief overview of the wider reforms within the service. We are now into the final year of the reform programme, and we continue to make good progress. The Oversight Group, chaired by the Minister, has signed off 19 of the 40 recommendations from the OAS report. A plan to deliver the remaining recommendations is in place, and I am confident that by this time next year, all recommendations will either have been implemented or will be ready for implementation. What I mean by that is, for example, recommendation 36 stated that there should be a new custodial facility for women in custody. A new build is dependent on funding being made available. However, by the end of this year, we will have upgraded the current female facility at Ash House and developed a new step-down facility for women on the Hyde Bank estate. On our voluntary early retirement scheme, I'm pleased to be able to inform the committee that we have secured funding to release the final 28 members of staff. Everyone concerned has been written to, and we are working on the finer detail to agree the date when they can leave. This is good news for those waiting to leave, and it will allow us to plan for the future with certainty and confidence. The year ahead is full of opportunity. For the first time in a number of years, we will have a settled workforce with the conclusion of the VER. Training and development of our managers and officers will continue. We will continue to build our relationships across the justice family and the wider community and voluntary sector. We're discussing with colleagues in the Department of Employment and Learning how we can develop learning and skills in our prisons. Our working relationships with key partners, such as the Probation Board, will further develop with a firm focus on rehabilitation and resettlement of offenders back into our community. Mr Chairman, all of this is being delivered against a backdrop of an increasing prisoner population. We've introduced performance measures that demonstrate progress in areas such as drug seizures, a reduction in assaults and fewer lockdowns. We're happy to take any questions you may have on these and other areas of performance. Mr Chairman, our aim is to help to build a safer Northern Ireland. The Prison Service can do this by working with offenders to help them to address their offending behaviour. Thank you for the invitation to speak today, and we welcome your questions on these or any other issues you'd like to discuss. Thank you.
Okay, thank you very much. And certainly the report by Sir Jenny into PECS is one for the first time in I think a long time that I've read such glowing commentary about the prison service, and I think that's to be welcomed. And I'm sure you're pleased with its content, and certainly I was pleased when I read it. And it's long overdue that these type of reports are being published about the prison service, and I think it is worth noting that and marking it. In terms of what has been achieved in PECS, obviously the relationships there have been important. Currently you have 19 out of 40 of the OR recommendations signed off. How is that relationship that clearly has changed the PECS system being replicated across the rest of the prison service so that the other recommendations can be brought forward?
Well, clearly the report that was published today says that what's happening in PECS needs to be seen as an example for the rest of our service. We've still got a lot of work to do on our reform programme, we know that, and we're not complacent. But what we are seeing is improvement in all three establishments and in PECS across a range of performance measures. And we know you'll want to ask about some of those because we've already suggested some of them in my opening statement. But for example, we are seeing reductions in the number of lockdowns across the three establishments. We've seen a measurable increase in the number of activity places, employment and training opportunities for prisoners in the three establishments. We are doing better in relation to what we find on searches. We're doing better in relation to drugs. So we are seeing tangible, measurable outcomes in all three prisons. We're quite clear that when the Chief Inspector next visits any of the three establishments, he and his team will see improvement. It's just that this has been an opportunity for us to evidence that improvement in PECS, and the changes in PECS have actually been outstanding in a very short time. The leadership in PECS have led our staff working collaboratively with the unions and just shown what can be done, but we're doing it across the service. We're very clear about that.
Good. Obviously the public will judge this whenever we look at what the reoffending rates are for people who obviously go through prison. When do you think we'll start seeing a change in those levels of reoffending rates reducing?
Well, I'll ask Brian to say something about that in a moment, but we all know that reoffending rates are something that have to be measured across a significant period of time, so we wouldn't expect to be able to demonstrate that anything we're currently doing will have a long-term impact on reoffending rates for some time. However, we can do some work to show a correlation between what we do with offenders when they're in custody and what we're able to do with them on release, for example, in terms of employment and accommodation, so that they are better able to settle into their communities. But if you're asking at what point will we be able to show a percentage improvement, for example, I would suggest that realistically we should be looking at 5 years down the line. But Brian, you may have a view both from this role and your former role.
I think I would say, Chair, the first thing is that most sentences imposed now involve a period in custody and a period in supervision in the community. That is why recommendations, or the PRT recommendation 29, 30 and 31 are so important. 29 is about a comprehensive assessment of risk and need, and we believe we've got the right questions to address in regard to that analysis. The sentence plan and the comprehensive assessment plan coordinates all the providers in prison, both prison staff and the external providers, of which there are many. And finally, recommendation 31 recommends that the probation board and prisons are more joined up, more integrated and have more exchanges. All of those will contribute to a reduction in reoffending.
And how confident will you be that the probation board will be able to do what's expected of it? Because I know this is an issue that I've raised before, because there is specialists within the prison service that deal with a number of these issues as well, and I know there's been some tension between who's ultimately in control. So how will that integration work, and who ultimately is in charge?
Well, we've spoken about this at previous meetings. PRT 31 clearly requires us to work more collaboratively with our colleagues in the probation board, and we are now meeting regularly, most recently this morning, with Cheryl Lamont, who's Acting Director of Probation, to look at how we can share services across the two organisations to get better value for money, but more importantly to get better outcomes for offenders. We are confident enough now, I think, and mature enough in our relationship to look across organisational boundaries at delivering elements of our service. So, for example, where we look at delivering interventions, where we look at delivering psychology services, where we look at the wider offender management agenda, both Cheryl and I and colleagues in NIPS and in the probation board are confident that it is less important who manages a particular bit of the service than that we have good arrangements in place to deliver across community and custody. So I think it's less important who manages it, and probation colleagues are clear that that's the case, than what we deliver in relation to outcomes for offenders. Brian, do you want to say
Yes,
a bit more?
if I could, Chair. We have done much work under PRT 31 in terms of clarifying roles and responsibilities. And my job is to develop the professional prison officer of the future who will take on a significant amount of the engagement, the assessment and engagement with prisoners during the main years of their sentence. We are reaching agreement, or at the point of agreement, that the probation board would major on the last 3 months on resettlement as prisoners are beginning to edge towards the gate and reintegration back into the community. We are developing a suite of programmes and interventions which could be delivered in a multifaceted manner. And I also need to look at what is provided by the voluntary and community sector in prisons to ensure that everybody's contribution delivers against the sentence plan that I referred to earlier, and that we are complementing one another and not duplicating one another, and we're using our limited resources to best effect. And I do believe that the delivery of that best practice model will allow us to influence the reconviction rates when people return back into the community.
Just so I'm clear, is it the prison service commissioning probation to do work for them, or for yourselves? Is that going to be the contractual way it'll operate?
Not necessarily. We have two things. We have seconded probation staff working in prisons, and they work in prisons under a service level agreement. So we buy, that's a purchaser-provider relationship. We buy that service from probation. So we ought to be able to be intelligent customers in how we purchase that. So we listen to what probation tell us about where they can add value, what their unique selling point is, and what is it that we need them to do rather than things that our own staff can do. So we have that relationship. But also there is the seamless management of offenders from custody through release into supervision and beyond. So that's the bit where we work collaboratively together as equal partners in making sure that we offer the best service to offenders.
No, I think the concept is the right one, but I just know in any merger, and it's not officially that's not maybe a good word to use, but where you're collaborating, ultimately there's always someone who needs to be able to say, because there'll always be issues with personnel in any organisation, someone ultimately does need to be able to go, this is where we're going. So collaboration, equal partnership is all good in theory, but you and I think both know in personal relationships when people are involved, there needs to be ultimately someone who's saying, well, I'm actually the person paying the bills here, so this is where we're going.
And sure, I would say that the prison service are in charge, and the prison service are buying the service against the assessment of risk and need, which I will have carried out under PRT 29, and that involves the probation board and every other provider in prisons. It is a mosaic of providers at the present time, and it is my task over the next years to bring some order to that, to ensure that we are all contributing what is uniquely our contribution, and that we are not duplicating what others are doing.
And finally, the points I just want to touch on the Invest to Save scheme. I think it was on Tuesday I'd asked the Minister, and he was able to update me that it was 14 and there were still 12 remaining. So are you now telling the committee that those 12 remaining have now moved to the letter 2 stage?
Yes.
Okay.
Yes.
Well, that is good news indeed.
It is.
Obviously, the sooner people can get out having now got the letter 2, but I think for a number of people, the fact that they had been on the letter 3 for so long and not knowing if they were even accepted onto this scheme had been a problem. So I think they'll take some comfort from that. Nevertheless, I'm sure they'll still pursue, well, when can I actually now go? But
no, absolutely, and we are hopeful that that will be fairly soon.
how many is that in total then that have left under the Invest to Save scheme?
Under the voluntary early retirement scheme,
That
Mark
will be, I think it's around 530 all in all.
Okay.
Give or take one or two. We just need to check that, but it's about 530.
And obviously the rationale for it partly was financial, and the other aspect was to allow people to leave with the dignity, and a lot of them had served during the darkest times of their career in the prison service, and that was quite right, that they would be recognised in that respect. But the repeating theme has been the costs of prisons in Northern Ireland is way above what it is in the rest of the United Kingdom. So when should we anticipate seeing the costs of running our prison service reduce as a result of this scheme now having been implemented?
Well, I'll ask Paul to give you some figures, because I've seen some figures only today in Paul's most recent visit report from his visit to Maghaberry. We are already seeing a significant reduction in our cost per prisoner place. We ought to say that we have in recent years seen a 30% increase in the prison population with no additional resources, which inevitably makes our cost per prisoner place much lower. But the most recent figure, Paul, you'll want to share with us, I think, because it's very good news.
I'll keep it short and sweet, and if you use Maghaberry Prison as your barometer, it is our biggest show. It does most of our business. The cost of keeping a prisoner at Maghaberry today is half the price it was at in 2007. So I think we're already seeing the dividend, and as each year passes, you'll see greater reductions.
Yep. So it's 40.
The
43?
if you're looking at the cost of keeping a prisoner at Maghaberry each day, it's around about £113, and if you go back to 2007, it was £234.50.
That's per day.
Per day.
Okay, had you worked that out, save me doing it on a year? I remember figures of...
You did put an annual figure, I think it was 40.
It would mean that if you were to work out the budget today, it would be about 45 million, which...
45,000.
Sorry, yes, I'm looking at the cost of the prisons.
Right.
It would be about £42,000 a prisoner,
Yeah.
which takes you into the ballpark figure of running a high-security prison in other jurisdictions. That wasn't previously the case.
Okay, well, that is good. Okay, members, Mr. Humphrey.
Thanks, Chair. Thank you very much for your presentation. You're very welcome. Maghaberry has happened. That is excellent news. I'm delighted to hear that. In terms of the other prisons within the state, can similar progress be made there in terms of savings, or is it a difficulty, for example, with McGilligan because of the age of the building?
No, we're still making significant savings at all 3 prisons. We've just done a reprofiling exercise which will bring new working arrangements in from the beginning of June, and in all 3 prisons we've made reductions to cost whilst improving operational performance. So we're seeing evidence of that in all 3 prisons. We measure slightly different things in Hyde Bank, obviously, because we have slightly different priorities.
Okay. Can I also welcome, in relation to learning and skills, the progress that's been made? I think that's very, very important in terms of people's self-worth, and I welcome that progress. I also welcome the joined-upness that there is in working with Dell and the regional colleges like Belfast Metropolitan College. I know that's probably an obvious statement to make, but all too often those who sit in these committees don't necessarily see that joined-upness actually happening, which is quite extraordinary, but in this case it's clearly happening, and I welcome that. In terms of drugs, and obviously there is a societal problem with drugs, and that then manifests itself in your prisons. I know there was a pilot scheme in one of the prisons. Has that been rolled out to other prisons?
Let me ask Paul to tell you some of the things that are happening in relation to our drug strategy, because there is that pilot in Maghaberry, but there are some other very exciting things happening which I think you'll want us to share.
Yeah. I mean, the fact is, work has been ongoing in all 3 of the establishments. We made changes last year in terms of moving away from rigid prescription about what we needed to do in terms of security, and we followed an intelligence-led agenda. And that freed up resources and allowed us to do things differently. And that's had a significant impact. If you're looking at Maghaberry Prison, it means that the rate of drug misuse, randomly test each month, we know roughly how much misuse is around and about. If you compare Q1 to Q4, it's a 10 percentage point reduction that's been noticed at that prison. If you take Hyde Bank, then that's to a similar margin. And if you look at McGilligan, last summer when we were testing prisoners, 21% would routinely test positive, and now it's around 6%. So we've noticed significant improvements over the course of the year since we changed our policies and that act. And if you look specifically at the pilot that was launched at Maghaberry, which was an initiative with PSNI, looking to educate staff, looking to educate visitors and to educate prisoners. There was an element of education and an element of deterrence and detection. Well, we're running at a rate of around about 30 drug seizures a month, and importantly, about 25 referrals to the public prosecutor each month at that prison. So I deem all of that to be successful. Maghaberry drew the headlines, but not necessarily all of the success that was shared.
Yeah, I do think that's something that needs to get with respect, because it very much, I think, certainly in my estimation, people are aware of the good work that's been done at Maghaberry, but not necessarily the other 2 institutions, and I think that's something which is another good news story, and something which got out. The problem is prescription drugs largely, isn't it?
There is an issue with prescription medication, and we've done a number of things in conjunction with our South Eastern Trust colleagues. So we've changed, when I say we, I mean health colleagues in discussion with us have changed the type of drugs that are prescribed in prison to make them less attractive to people to buy. So they're drugs that are less addictive, and so we've seen instances where some prisoners who've been on medication for a long time have actually said to the healthcare staff, I don't want those drugs anymore. So it's been clear that these people haven't been taking their own drugs. They've been selling them, or they've been bullied for them, or they've been moving them on to other prisoners. So we've seen a reduction in that. We're also looking at how we can require some prisoners who can't really be required to hold their own drugs in their possession. They take their medication under supervision, something which we call supervised swallow. So that removes the opportunity for them to sell those drugs or not take them. So we will see, certainly as we look at the drug testing figures, we'll see that the number of prisoners testing positive for prescription medication that's not their prescription medication has reduced.
And I welcome the figures that we have in front of us and the testimony you're giving us here today, but obviously there's room for further improvement. Can I ask you, you just mentioned there about with some prisoners the drugs will be retained and given on a daily basis. Why can that not happen with all?
There are two bits to it, and Paul may want to add something. The first one is that what we try to do in prisons is to normalise the environment so that as much as is possible we reduce the way in which people are institutionalised or not given responsibility for their own daily lives. So most people in communities would be allowed and expected to retain and take their own medication. So it's absolutely proper that where prisoners can be trusted and allowed to do that, they do that. It also slows down the regime. It does slow down the regime a significant amount because it takes a number of healthcare staff to supervise the medication, which means those healthcare staff are not available to do the things that they are qualified to do and which they're more appropriately employed to do. So holding clinics, supporting prisoners, delivering therapeutic interventions. And we know from conversations with our healthcare colleagues that some very highly qualified nurses are frustrated that they are being required to stand over people while they take tablets. So it's really using quite an expensive healthcare resource to best effect. Do you want to add to that?
If I can elaborate, if you are vulnerable and you are serving a sentence in a Northern Ireland prison, then the dispensing of your medicine will be supervised.
Yeah.
If we think you trade your medication, then the dispensing of it will be supervised. And at 2 of our prisons, the 6 most tradable medicines are supervised when it's dispensed. Interestingly, we're seeing the demand for some of those drugs ease off in consequence. At Maghaberry, that's been extended. So far, 2 of those 6 drugs have been rolled out. It's the sheer scale of the exercise in a prison as large as that, which has meant that they've had to take gradual steps towards full rollout. And in a prison where 9 out of 10 people will be taking some form of medicine, the prospect of asking nurses to dispense and consume every tablet and every dot of medicine would be quite frightening and would kill the regime.
Yeah.
So 90% of prisoners are taking some form of medication.
We'll take some form of medication, be it from a paracetamol to something quite heavy duty, but 90% will be taking some form of a medicine.
Okay. Well, I welcome the news that you're on top of this clearly, and keen to drag the figures down even more. And clearly, we had a drugs problem in our prisons, and I think probably to an extent we still have, but it's good and welcome news that you are on top of it, and I welcome that. Can I just ask, in terms of the estate management, I see the business cases for the step-down facility and the new women's prison have been submitted. Can you give us any information as to when you feel these 2 facilities may well be open and ready for use?
Okay. The step-down facility for women is something that will allow us to have a different facility in place quite quickly. And actually, the step-down facility is a domestic-type house. So it's a 6-bedroom house where 6 women will be able to live in a small supportive community where they will be responsible for their own daily living. And we've come up with that idea really ourselves and in consultation with some of the women, the long-term women prisoners in Ash House. So we think that will be an appropriate facility for women who are either coming to the end of a longer sentence or who are deemed to be low risk. The provision of the replacement for Ash House will take a bit longer, will take significantly longer actually, because that's a much bigger project. So we are already starting to finalise the design for that, and again we've designed that in consultation with the women prisoners, with some of the groups that represent the interests of women prisoners, with the Prison Reform Trust, with health colleagues, with criminal justice colleagues. But obviously that remains subject to the funding being available, and we wouldn't envisage being in a position to open our new women's prison before 2020.
But is the Justice Minister's budget not ring-fenced?
In terms of the capital expenditure for the new women's facility will come from the next spending round, so it's subject to funding being granted. So it's a long-term project, as is the redevelopment of McGilligan. But what we are doing at the current time is improving the facilities in Ash House. So we're currently redeveloping the ground floor in Ash House to provide activity for the women. And we are already introducing improvements to the regime within the constraints of Hyde Bank. Or do you want to say something else?
No, it was echoing those sentiments.
Okay.
That it's not insignificant, the work that's taken place in Ash House. The infill area will provide a great deal of activity, and we do have the sit-down facility coming.
I spent time with the women in Ash House on Monday evening with the new Governor, Austin Tracy, and in an informal setting, just having a meal together and having a discussion about the improvements that have been made to the regime. And the women I spoke to were absolutely clear that the regime has improved in terms of the quality of the activities on offer for training and employment, and the number of opportunities that are on offer. So it is better than it was, even within the unsuitable physical environment.
And the big change, of course, we were often criticising, quite rightly so, because of the high level of lockdowns that took place at Hyde Bank. And if you look back to last April, then on a typical day, 1 in 8 individuals might expect to be locked down. And now it's 1 in 50. And it's got some improvements still to go, but it has improved significantly.
The other thing
but I am right in saying that the Justice Minister's budget is ring-fenced, so this is not a case of, this will happen, all 3 of these will happen, yes?
Yes.
Okay.
Yes. The other thing that it's just worth saying while we're on the subject of women, and I think we may have mentioned this before, is that we now have a risk and intelligence-led approach to searching, so we no longer carry out full searching of women, other than where there's specific intelligence to suggest we need to do that. That's even on initial reception and on discharge from the prison, so we don't carry out routine full searching of women. And again, talking to the women, that's been a significant development for them. It hasn't impacted on safety, it hasn't put either prisoners or staff at any more risk, it's just a more proportionate approach.
Thank you. Thanks, Chair.
Mr McCartney.
Thank you very much, and thank you for the presentation. Just in relation to the PECS report, I mean, obviously, again, it's very welcome, but I just noticed in the conclusion that, one of the insights of the inspector was that this was possible by clearly defined objectives, determined leadership and enthusiastic teamwork. So it's a good template for improvements in our places where if it's required. In October, when you were last here, Brian spoke about rehabilitation having primacy on the agenda. So how now has that sort of rolled out from your perspective now that you're in post maybe a bit longer than you were the last time?
Well, I'm in 7 months, and I would reiterate that comment that I and my colleagues give primacy to rehabilitation, and my work, and I repeat again, around the RT 29, 30, 31, 37 are all areas that will ensure that the needs and the risks presented by prisoners are captured at committal are translated into a sentence plan, which everybody working in the prison will have to contribute to, overseen by a prison officer who will coordinate the delivery and ensure the delivery of that sentence plan and the review of that delivery. And as it were then, Chair, passing on the baton to the probation officer in the last 12 months of the sentence to prepare for eventual resettlement, which will include home leaves and testing out in the community or in facilities provided by partner organisation. And I think that is a much more joined-up approach than has existed in previous years, and I think that will translate itself into a prison service which places rehabilitation at the centre of all it does and grasps the opportunity that a period of prison provides to bring effective and positive change to those who are sentenced by the courts to a period of imprisonment and lead to a reduction in reoffending.
Okay, thank you. And the last time it was also said that the Hyde Bank's reprofiling had just concluded. The other two were still in progress. What has the impact of the reprofiling had on a day-to-day measurement?
On the regime that's delivered.
Yeah.
Paul, do you want to just say a bit about the day-to-day impact? I mean, clearly the reprofiling has put, as we've said before, it's put the staff in the right place at the right time, in the right numbers, doing the right things. But in terms of the day-to-day impact...
It has certainly helped in terms of predictability, and that's probably best measured by lockdowns where they were unpredictable, they were disruptive to prisoners, but at Magilligan Prison they've all but been eradicated. And at Hyde Bank, as I said, not where I would want it to be yet, but significant improvement where 1 in 8 were locked up and now it's 1 in 50 who might expect to be locked up on a daily basis. But we haven't lost anything in terms of supervision either. I would say that our capacity to supervise has been enhanced, and I think that's evidenced through the assault rates within the prison. Because despite the fact that the population is going up, so the task is getting harder. It's nearly a 7% rise last year and close to 5% this year. The assault rate at Hyde Bank has halved since the first quarter to the current quarter. And we've seen similar reductions at Maghaberry, where it's down 1 quarter, and pretty even at Magilligan. So I think we're still supervising well. I know we're getting more prisoners into activity on a daily basis, and I know there are fewer lockdowns. So it's been pleasing. But it's not a job done. The act of reprofiling will need to be done on an annual basis because things change in prisons and we need to keep improving.
And you said there's more people in the activity. What's the measurement of that? What's the sort of... Is it increased courses, increased vocational training?
Yeah, I mean, Brian may well want to come in a moment, but I look at it on a hard numbers basis on a day-to-day basis. And if you're looking at a prison like Hyde Bank, where I think everything should be about activity, well, we now have 60 more workspaces identified on a daily basis. That means typically there are around about 190 activity spaces and about 220 people competing for them. So far from an establishment where activity would be a rarity and there was a paucity of it, it's now got the basis of a proper curriculum and a proper regime. Brian, you might want to come in.
No, that's the example I was going to quote in terms of Hyde Bank Wood, but maybe to wrap up some of the questions that have been posed today. As far as Hyde Bank Wood is concerned and rehabilitation, if we can get to the point where all of the youngsters leaving that establishment have learned to read and write in terms of our learning and skills provision, I think that's a tremendous contribution to Northern Ireland Prison Service in terms of the rehabilitation of those individuals. And whilst that may be a small measure, it's a most critical measure. And in answer to your earlier question, Ms McCartney, a sentence, again, is a period in custody and a period in supervision. They are the same individuals. The prison service are working at a particular point, and the probation service are working with a particular point. I must ensure that there's a flow of information across those organisations, that the assessment of risk and need is managed in prison and passed out into the community. But I also must ensure that the programmes and interventions delivered in the community can be delivered in prison also, so that if somebody gets 3/4 way through a programme or an intervention, I can pass that individual out into the community where they can finish that programme. So it is a joined-up approach to the management and positive change of offenders. So it is a joined-up approach to the rehabilitation of offenders and the reduction of reoffending rates in Northern Ireland.
And in terms of the rate in our two establishments, McGilligan and McGarry, in terms of the number of places for people to be involved in curricula, what's the rate there? Is it lower or higher than Highbank?
No. If you're looking at McGilligan, it's not too badly placed in terms of the number of regime places, and also because, by virtue of its design, you can't crowd out McGilligan Prison too much. There is a limit to how many people can stay there. So the levels of activity have never really been problematic at McGilligan. If you're looking at McGabry, well, that's a challenge, because you have an establishment that is facing the consequences of a growing prison population, and whilst we've added more beds in, the plant hasn't gone in to increase the number of activity spaces. So we've moved to a different model there, one that says, or let me start again, we're in the process of moving to a different model, one that says if there aren't enough jobs for everybody, then let's do our best to make sure that everybody has part of a job. So we're splitting the employment within that prison to make sure that certainly every sentenced prisoner and those who are unsentenced and who want to work have the opportunity to work for part of the day. That has increased the number of people who are in work, but certainly not quite to the levels at Highbank.
Yeah. And in terms of Highbank, what's the pickup like? I mean, the assault rate, obviously, it's an indicator of sorts, but certainly an impressive one. But what's the pickup among the prisoners? Are the prisoners responding to the new purpose and new sense of rehabilitation?
Yeah, it's improving.
Yeah.
It's not a job done. Nothing we've said today is a job done, but it is improving. But I think the most noticeable difference at Highbank now is the fact that the prison allows free flow. Whereas before, we wouldn't trust prisoners to move from A to B without a prison officer taking them. There is now a free flow operation running across the establishment, and that does make a difference.
I would not want to give the impression of a job finished. It's a job started.
Yeah.
And I also said the last day that our task is to bring prisons closer to the community and the community closer to prisons. And I want more opportunities for prisoners to be tested out in the community, to have the opportunity to make amends and pay back for what they've done through working in the community, and particularly in relation to victims. Those are all developments and opportunities. It's a job started, and a job we're determined to finish.
And is there a measurement of, say, like in terms of tackling literacy, is there now a measurement where you have some sort of sense of what's achieved by the end of someone's prison sentence in terms of literacy? And
Well, absolutely. In terms of putting together the specification for learning and skills, basic skills, basic literacy and basic numeracy are the priority. So that's what, for example, Belfast Met will be delivering in Highbank before they deliver anything else around vocational training and additional education. So we would certainly have as a measure, we would assess everybody coming into custody to see what their level of literacy and numeracy was, and then we would measure people as they left our custody, just to make sure that everybody has reached the standard that people need in order to function normally. So the standard that you need to be able to read a newspaper and fill in a form and so on. There will be some people who require something more, but that will be our priority. Brad, do you want to?
The model we are adopting is that our new providers will major on the curriculum. They are the experts in terms of learning and development. We will also appoint activities managers who will make sure that we get the individuals to the classroom, because I think that has always been a difficulty in terms of motivating the unmotivated who have not had good experiences of the classroom. So we will appoint activities managers in each of the establishments. Whose task it will be to ensure that we have the people filling the places, and then we have the experts who will be leading the curriculum delivery.
And I think that's quite significant. We've had some conversations already with Belfast Met and North West College, who are our primary providers. There is little point, if you've got a young man who stopped going to school when he was 8 or 9, there's little point putting him in a classroom and expecting him to sit there for 2 hours learning to read. That just won't work. What we can do, though, is embed those literacy and numeracy lessons in things that people are more minded to do. So Belfast Met, for example, are very good at this. They're working with some very hard to reach young people already in communities. So, for example, you know, if young men are interested in cars or in computers or in gaming, they can embed literacy and numeracy in those things, so that actually you're learning to read and learning to write without anybody requiring you to sit down and sit quietly in a classroom for 2 hours. So we're realistic about what we can achieve with these young people who largely have been turned off education at quite an early age.
Okay, just two broad final points. In terms of the structure you have in place, are you happy it's robust enough to withstand any, say, change in personnel or change of circumstance? And I suppose the final thing is that, you know, an observer, say someone from the review team, if they went into your establishments now and looked at them, are you confident enough that they would say, yes, we have seen change?
Two things. The first bit of your question is, of course, we need to put structures in place that don't depend on individuals, and we're doing that through our succession planning strategy. And we include ourselves in that. We include, from the very top of the organisation, at every level, we need to have robust structures in place. As to the review team, we actually have 2 members of the review team who sit on our Prison Service Management Board as non-executive directors. So they are in the prisons quite regularly and giving us feedback about how they see progress. So the feedback we have really reflects what we've said, that much has been achieved, but still quite a lot left to do.
Thank you, Chair.
Dixon?
Chair, thank you, and thank you for what is clearly an emerging good news story in terms of our prisons. You've said and admitted yourselves that there's a long way to go yet. It's work in progress. It's perhaps only the start of the work. There's a lot more to achieve, but at least we are starting to hear an improving story coming out of the prison service. There are a couple of areas just I would like to concentrate on. One, just looking at the PRT progress to date, and I note just on the table that there are a significant number are either completed or are described as signed off. Although they're complete and although they are signed off, will they in turn be reviewed and refreshed?
Yeah, I'll let Mark pick up on this, because we've actually just had our regular programme board meeting this morning and we've been talking about this. And we have already mentioned there will be some things that will be signed off but not yet delivered because they're subject to funding. And we need to be clear, what is the role of the oversight group that's appointed by the Minister to oversee progress? And when do the recommendations become business as usual? So when do they become business as usual? And after that, how do we assess our continuing progress? Our view is that there is a continuing role for the inspectorate, but it's how we manage that transition. So, Mark, do you want to just pick up your area?
One of the pieces we've been looking at with the oversight for some months now is the benefits realisation plan. So things that we can actually feel and are different in 2 to 3 months, and things that will feel and look different in 2 to 3 years. And we're into those kind of conversations now. How do we embed that as a business as usual product, whether that's the inspectorate as part of what they do, business as usual, if there's other mechanisms of accountability that show when we hit those points that some of the process changes and the interventions we put in place are actually yielding the kind of differences in terms of increased numeracy, literacy, in terms of reducing reoffending, all of those kind of things, so we can actually start to say, were those tweaks and changes we made to the system the right kind of tweaks and changes that we made to the system over time.
And where does that fit into, do you already have an existing continuous improvement programme, or does that in itself feed into continuous improvement, and will that be where the future lies in terms of delivering, I suppose, that investors and people type concept of continuous improvement?
Yeah.
Sorry, it's a little bit of both. So a lot of the stats and the figures that Paul's alluded to have gone through are things that we track now on a regular basis. They give us those indications. Are we going in the right direction, the wrong direction? Are the reviews that we have, the kind of the temperature checks that we get from the reviews, like we've just had through to Ginny, give us a feel of what's happening now.
Yeah.
And it's a combination of all of those that starts to pull together a feeling of direction.
If I could turn to one of the changes that has occurred, and that's you made reference to a number of external providers, one being in education, but probably the most for me the most significant external change is that of the contribution of health in the prisons. To what extent is that part of the success story, and what are the barriers and difficulties that you still perceive in terms of the delivery of health care?
Okay. You're right, it is absolutely proper that health professionals deliver healthcare in prisons, and we've seen significant commitment from our trust colleagues to delivering an excellent service, a service that is equivalent to that delivered outside. Obviously, there were some teething issues. For example, they recruited nurses to work in our prisons who perhaps hadn't thought through whether this was the environment for them, so we had quite a high turnover of healthcare staff at the beginning of the new arrangements. We addressed that together in partnership by putting in place better induction arrangements. We supported people through those early weeks and months, and we've seen a reduction now in the turnover. So we've now got a more static health workforce, and we've got clinical managers in place in the 3 establishments, which has really made a difference. So there's somebody in charge of healthcare. On a day-to-day basis, the partnership working is excellent, and I've seen it for myself, and I know colleagues have, where we have multidisciplinary groups supporting particular prisoners and patients, and helping them to work through crises and so on. We do know, though, that perhaps offender health might not be as high up their priority list as it would be ours, because it's our core business. So we know that the South Eastern Trust deliver health to offenders in prisons, but they also deliver to communities, a whole range of groups within the community. So we know that we have to compete for resources and compete for attention with these other groups. What we do have is we have a really robust governance arrangement. So we have a regular strategic partnership meeting where I attend, the Chief Exec of the South Eastern Trust, Hugh McCarthy, attends, and senior people from both organisations, from the Public Health Authority and from RQIA, all attend to make sure that we've got the right strategic model. And there are also a number of meetings that happen further down the organisation at an operational level. But we continue to explore how we might be more effective. So, for example, when we talk about prescription medication, I'm absolutely clear that if we can have more and better activity in prisons and tire people out during the day, the demand for prescription medication to help people to sleep will reduce. That's pretty obvious. We've just introduced an activity, for example, we take women from Ash House swimming every week. So we take a minibus of women from Ash House, and they go swimming. They tell me that that's a great activity. It's around confidence building, and there's a real health benefit. There's an emotional well-being benefit, but it also makes you quite tired. So what they're saying, we sleep better on those days when we've been swimming. Well, we need to engage with our health colleagues and say, how do we actually frame that as a health initiative so that people can understand what the benefits are, and it's not just seen as something that's nice to do, it's the right thing to do for clear health reasons. Similarly, we need to think about health in a more holistic way, so it's not just physical health, and it's what are the mental health benefits of some of the things that we're doing, and what are the emotional health benefits. So we know that there are colleagues in health who are just as excited as we are about some of these things. It's just how we embed them in the strategic priorities for health, if you like, that is the challenge.
Just finally, the prison environment is very different from the community, and while a clearly good objective is to deliver as good health care as the community can receive, nevertheless, how that is delivered in a prison setting is very different from the community, and there aren't perhaps the same number of support mechanisms available inside a prison that there would be in the community. You know, just knocking the next door neighbour and ask them, I've got a headache, what do you think I should do about it? How are those things, how are those concepts being understood by the Health Trust, who for the first time are working in a very different environment which they've never been in before?
They are learning, you're absolutely right, Stuart. For example, if you've got raging toothache, there are lots of things you can do if you're at home to distract yourself, whereas if you're sitting in your cell with raging toothache, then the idea of waiting for a week to see a dentist is less bearable. So we need to take account of that. I think the only way we can do that is by joint learning and just giving them time to get used to that environment. It's not really a very exact science. It's just giving them a better understanding, as I say, through good induction, but also through good communication. So, for example, I recently attended a SPA review meeting, so the review of a prisoner who was subject to SPA procedures, and that meeting was attended by the prisoner stroke patient, by the senior officer, by the nurse, by the mental health professional, and they were all able to talk and share their views on how that person could best be supported. So it's all of that multidisciplinary work and good communication that will help.
We should highlight the work that's ongoing as part of PRT, where health and prisons have been working together. A draft strategy has emerged about how we manage health in the future in custody and before custody and post-release. Now, that a lot of work and a lot of investment has gone into that. My understanding is it's likely to go to full public consultation around June, but they've clearly been on a listening exercise.
It's very helpful. Thank you, Chair.
Thank you. Mr McGuinness.
Thank you very much. I think the questions have almost been exhausted.
Good.
Might want to. Have you an extra question? But I suppose a good sign, really, in many ways. Congratulations, first of all, in relation to PACS. I think it's a great report. But also congratulations in relation to the report that you've given to the committee. I think there's been very significant progress made, and I think that we should be, we should be affirmative when we hear good things, which we have today. My main focus of attention would be the educational opportunities in particular for young people and young prisoners. You covered, I think, most of that, but is there anything else that can be said in relation to that? The contract, I know it's only an interim contract at the moment with Belfast Met, but presumably that will be made permanent. How is that going? I know it's early days yet, but how do you think that's going?
Well, I'll invite colleagues to speak. We know it's been slow in starting in some places, not least because the organisations delivering education, the colleges, needed to know they'd got the interim contract before they could go ahead and recruit teachers. That's obvious.
Yes.
They couldn't.
Yeah.
So it was only once they knew they'd been awarded the contract that they could start putting people in place. So
yes.
It felt a bit slow at first because of that. Where we have now got Belfast Met people in place, and of course North West College are in place in Magilligan, but they've been doing some of that for quite a long time, so that felt less of a big change. But where Belfast Met are working in Hyde Bank and Maghaberry, it's just fantastic in some examples. We've got examples of some really enthusiastic, inspirational individuals coming in and making a real difference quite quickly. So the signs are all very good. As Brian said, we just need to get the management arrangements in place. And Belfast Met, for example, have just appointed in the last couple of weeks a person to lead for them on prison education. North West College have had somebody in post for longer because they've been doing it for longer. But it's important sometimes to have one person who is the go-to person and the person who leads on that. And we'll have our own managers as well to support that. Brian, do you want to?
We are currently engaged with Dell in terms of transferring the delivery of learning and skills to the experts in terms of learning and skills, and that's what we seek to do. I think the new providers have individuals who model the way and enthuse, and when you can get umpteen young men queuing up to get involved in a catering class, then I think we know that we are properly motivating individuals to get involved. One final comment that I could say, I think the change that I want to bring about is that sentence plan delivery dictates the prison regime, no matter what prison it is, and that the life in the prison is about delivering that plan so that the person is less likely to reoffend on release. And that
I think the other thing we should mention, Alban, as well, though, is we're not doing any of this other than to build safer communities. So all of these things that we're doing in prison, we know will make an impact and make prisoners more likely to get employment or training on release, and more likely to stay away from offending when they go out. So all of the things we know about desistance tell us that if we can help people to form relationships that are not based around criminality, then that helps people to resettle successfully back into communities. So we've got some really good projects. For example, we've got a project with young men in Hyde Bank with the Lyric Theatre now, where the lads from Hyde Bank have been going out to the Lyric and will be going out to the Lyric, but will also be working inside the prison to do some set building. They'll be looking, the Lyric are keen to look at whether they can offer internships to young men as theatre technicians, lighting technicians, set builders. We're looking at front of house opportunities, because all of those things are realistic opportunities for employment on release, but also introduce those young men to a world that isn't about crime and offending. It's actually about how you use your skills and your leisure time in a more productive way and form relationships that are good, healthy, law-abiding relationships. So it's all of those things we think, but it is all about reducing reoffending and building safer communities. Right?
I think one other alternative, or one other initiative we have delivered, which I was very enthused about, was where we, with young men and sport, we brought in the sports of rugby, soccer and GAA, and on a full afternoon, all of the young men involved in that exercise participated in all of those sports. And I thought that was a great learning and a great cross-community and a very positive event, and one we can build on.
Well, I wish you well. Just one point on the drug testing. This came up at our committee meeting last week, the tail end. Most of the, and correct me if I'm wrong, but I'm with the proposition that most of the abuse of drugs is prescription drugs within our prisons. But the capacity that you have at the moment seems to be really for the detection of illicit drugs. Now, if that's, I think I'm right in making that assertion. If I'm wrong, you can correct me. Do you think that you need a wider capacity or an additional capacity in order to determine excess use of prescription drugs?
Okay, I'll ask Paul. This is about the capacity of our current drug testing contracts, isn't it?
Yes.
Paul, we've talked about this a lot because we're aware of the concerns.
Yes.
I mean, the fact is there is some capacity to test for medication.
Yes.
And where our health partners think it's wise to do so, we've got the capacity to go back and say we would now like to test for this. And our service provider has to act accordingly, give us that capacity. But this is an area where you need to be careful what you wish for. If we know that 90% of the men at Maghaberry are on some form of medication, then 90% of the tests will register as being positive for something. And prison officers aren't given access to medical records, and neither should they have that access. So you're requiring a clinician to stop what they're doing to cross-reference the test results against the prescribed medicines, to check to see whether anything could give a false positive or whether it's in line with the expected results. Now, that is laborious and time-consuming. It will stop nurses and doctors from treating patients. So it's not an area where you can walk into with giving proper foresight, and hence we've taken the view that we should be led by our health partner.
Thank you very much.
Okay.
Thank you, Chair.
Mr. Elliott?
Chair, thank you, and thanks very much for the presentation. I'll just follow on from Mr McGuinness's point on the drug testing, because it is quite a significant issue, and I refer to the table that you have presented with us, or presented us with today. Do you believe there is a drug problem in the prisons?
Well, absolutely there is, because 55 committals to Magabury every month will come in with some form of substance dependency. So if 55 people coming in every month are dependent on some form of substance, then absolutely there is a drug problem within prisons. Our job is to treat that problem, to encourage people to move away from that lifestyle, and to give them routes through. So the problem will be enduring. Our challenge is to try and address it, and the figures I gave earlier, I hope, give some assurance that there are improvements.
And it is probably worth saying, Tom, that later this month we will open Glen House as a drug recovery unit in Magabury, where prisoners who indicate that they want to leave that lifestyle behind will be supported on a 24-hour basis by staff, prison staff and staff from external organisations in addressing their addictions, and we'll then put in place support, relapse prevention type support to stop them going back to drugs. So that's the first unit of its type for us, but the idea would be that we would roll that out more widely. The governors of Highbank and McGilligan are already quite interested in whether they can do something similar.
Well, no, that's interesting, because I do appreciate the problems, because it is really difficult when that number of people come in with the substance abuse and difficulties that comes with it, how you actually deal with it, because you're left to deal with it in a prison situation. Yeah. And I understand the figures you gave earlier, but and I'm pleased to hear of that the new exercise and proposal that is, but I suppose I just wonder, are there any other new incentives or initiatives to try and deal with those aspects? And I don't know whether it's like isolation of those that come in with the drug problems, trying to isolate them from other prisoners, or they're just too many. Like it's just because I don't know them that I'm asking the questions.
Well, of course, you're right. There is a sense where you would want to keep people away from people who might want to sell them drugs or discourage them from moving away from drugs. And part of the principle of Glen House, which will be the drug recovery unit, will be that those prisoners will be separate from the general population, but they will obviously be in a large group so that they can offer one another support, and they'll be supported by staff. There is a tension between needing to treat people decently and recognise that the early days in custody are when people are often at their most vulnerable. So that's the time when you might least want to isolate somebody, and the need to address problems around addiction. So that's why this is a tricky business, dealing with some people who have very challenging needs and behaviours. But we think that the provision of support services, some of those being residential for prisoners, is the way forward.
It might be useful, Chair, because once you look at a table with figures on it, it doesn't give you the entire story. It might be useful if we got a separate, not saying an oral briefing, but at least a briefing paper on the management of drugs and rehabilitation of prisoners.
Yeah, we could do that.
It might be helpful to us.
Yeah, that'd be good.
Okay, a couple of other things just on the voluntary retirement scheme. Filling those places and new officers coming in, I am aware of recruitment process that went on, and I think that candidates in that had a time span of 1 year, was it? You could bring them in. When is that complete? Or
in terms of bringing in new officers?
Yeah.
We've now finished our recruitment.
That's finished now, is it?
Yes.
Yeah, a last lot of staff coming to PECS have come in. We do have a merit list that is still open for another few months. So if we did need to call off that, there would still be those initial people that applied would still be able to pick up without us running a new campaign. So we have that open for a window of opportunity, but that will come to an end, I think it's the end of June.
Okay. And finally, figures you gave earlier about 2007, it was costing £234 per day to keep a prisoner. The Maghaberry, now it's 113.
Yes.
Why was there such a difference? Where was the efficiency of the savings?
Well, most of our costs are staff costs, so the fact that we now have a significant number of staff who cost us less than some of the staff who've now left the service. We also have different staffing levels in some areas, so we have, rather than a one-size-fits-all, as we've talked about, we have more proportionate staffing arrangements. So much of it is that the staffing arrangements are different. Some of it is that we've accommodated a 30% rise in the prisoner population with no additional resources, so the cost is spread across a larger group of prisoners, and more accommodation. We've opened new accommodation as well, so that would account for the difference.
You don't believe that reduction in resources compared to prisoner population in any way reduces the level of management that you have within the prisons?
Sorry, some of it is that we've flattened our management structure and we've changed the gradings of our managers, so there will be, in some cases, managers in different grades and fewer managers, so the span of control for some managers will have changed. But if you ask whether we think it has made our ability to supervise and manage poorer, we would say no, it has not, because at the same time we've invested significant resource in training and developing our managers. And they have told us that they feel that we are investing in their development. So our managers are more effective. There might be fewer of them, but we have now, we believe, more proportionate spans of control for our managers and more realistic staff.
I think, although in fairness, Sue, my point was about the management on the ground, not so much your management here, but the management of prisoners on the ground, and is that compromised in any way?
Oh, sorry, so we're talking about... we would argue not. Paul has already mentioned reduction in the levels of assaults, which is usually a good indicator of staff control and good relationships. Paul, do you want to...
Well, I think it's twofold. I think, first and foremost, us introducing performance measures allows us to gauge whether or not situations are improving or whether there is any erosion in those areas. And that's a help, and all of that is pointing to an encouraging picture. But the other part is PRT, and it has changed the way we do our business. You know, people now understand that there has to be a greater amount of attention spent on prisoners who are at risk of harm. Processes that have been built in to ensure that works properly. Just one of the examples of the way we do our business differently now, to make sure that we compensate for the fact that the prisoner population is up, but staffing numbers aren't.
And it's probably worth just sharing very briefly an anecdote. I recently did a shift in Maghaberry, a 12-hour shift shadowing a senior officer, a first-line manager, precisely to see for myself some of the things you've been talking about. A number of things struck me. I did it on one of the square houses on Lagan House, which is currently crowded more than we would want it to be crowded, so it's got more prisoners on it than we would like. Notwithstanding that, I shadowed the senior officer and was hugely impressed by the way he ran that house. His grip, his management grip of the staff and the prisoners and the regime was impressive. But the other bit, which you'll be particularly interested in the context of earlier conversations that we've had, I spent the day with a team of staff on that house. Some of them were new custody officers, the new CPOs, and some of them were main grade officers who had chosen not to exit the service. I couldn't tell which were which. I could not tell which were which, because the level, the authority and the confidence displayed by those new officers and the responsiveness to the new way of working shown by the main grade officers both sort of belied the time that they'd been in the service. So it was genuinely an integrative group. What was also really impressive was the authority that those staff had over prisoners. It was really good to see excellent staff-prisoner relationships. Prisoners and staff were using first names, but there was respect, there was mutual respect, there was authority, appropriate authority, and all of the prisoners were unlocked for all of the day doing various activities. So it gave me confidence that we haven't eroded the supervision of staff by first-line managers or the supervision of prisoners by prison officers, and it also gave me real encouragement about the way that our new staff had been assimilated into the service.
Okay, Chair, that has broadly answered my final question, but just one part to it. How are the new prisoner custody officers getting on with the old ones? I'm sure, or the more experienced ones. I'm sure they were all on their best behaviour when you were there, but in general terms, we have talked about this before. There has been a friction, as I sensed it.
Yeah.
How is it now?
I'm not sure they were on their best behaviour. Maybe they were, but for 12 hours it'd be hard to sustain best behaviour for that long. But I take your point. We are getting very good feedback in terms of how the two are getting on. The other thing we've just started or are doing is the training for the main grade officers now. So there was a sense that we'd brought these new staff in and given them really good quality training at the college. We've now started to give some of the main grade officers training to bring them into the new ways of working, so that they actually feel valued and they feel that we're investing in their development. But in terms of, Paul, more than any of us, goes around the prisons really drilling down and looking at the way that the staff are working. You might want to give your sense.
I'm not sure there are two groups of staff anymore. And if we sit in this room and say that the new grade of officers have been successful, then I want to give a lot of the credit to that, to their experienced colleagues who've worked alongside them and brought them along and helped to make that transition seamless.
Yeah.
All right, thanks. Thank you, Chair. Thank you.
Thank you, and Ms McCorley.
Carly, thank you, and thank you for the presentation. I just want a couple of specific questions rather about clarity. When you were talking about activities that people were involved in, you were saying that there were more people waiting for places than there were places. Are those workplaces, or does that include every activity type? So what I'm wanting to know is, are there prisoners who are sitting with nothing to do at all?
I think what was said earlier on, we highlighted particular activities that generate a high level of demand, and for those, demand exceeds supply and that there are waiting lists for it. That doesn't apply across the piece. But if you take as the example an institution like Hyde Bank, then we know that we have up to 190 activity places and around about 220 people actively pursuing those activities on a daily basis. That gives you a feel for the level of activity.
Okay, so there are people then who would like to be in the activity, but there's not enough space?
Yes.
Are they doing something else?
The way it works, it's fortunately, it's more of we take a timetabling style approach. So this isn't as hard and fast as saying that 85% of you can feast and 15% of you are in famine. Yeah. It's the bit about spreading it across that population as best you can. There are some who will try to avoid engaging in activities, and our challenge is to engage them in there. Some cannot be compelled to do so. They're unsentenced, and it's a matter of choice. But generally speaking, it's shared as evenly as it possibly can be.
So, about what percentage of prisoners would you say weren't engaged in anything at all?
Then it varies across the establishments. I would say at Hyde Bank, looking forward, there's very little excuse for anybody to not have some form of activity. If you go to Maghaberry, it'll be a much higher figure because
of demands?
Well, no, because the population in Maghaberry is very close to 1,100 prisoners now, and we've not been able to keep pace in terms of putting plant in, workshops, education facilities to match the growth, which, if you take the point that Dame Anne O has produced her report, population's up 30% since then.
Yeah.
That wasn't predicted.
I think the important thing to say, though, is that that doesn't necessarily mean that people are locked in their cells. In fact, it's really only in certain areas such as the CSU that you would have that at all. So even where prisoners are not in employment or activity, they would be unlocked would be the default position, so that they would be able to engage in their domestic things. They would be able to have some level of association. They'd be able to have time in the fresh air and so on. So it's not that people are locked up, and in fact we don't accept lockdowns now other than in exceptional circumstances.
But would your intention be that every prisoner would have at least one activity?
Yes, and certainly the initiative I discussed at Maghaberry, which is the greatest challenge, identifies that's exactly what we want to do. We recognise there isn't enough activity, enough jobs per se to go around, so the default position is that sentenced prisoners should have half a job, a part-time job. And those who are unsentenced who want to engage can also have an opportunity for activity. But the expectation now is, rather than allowing some to feast and others to famine, it's to give everybody a bit of activity.
In terms of women prisoners, then, would there be any women who wouldn't be involved in some activity?
Again, it would be very small numbers, and other than we have, for example, we have one woman who's got a very small baby, so she doesn't work. She looks after, of course she works. She looks after her very small baby. But there may be women who are over retirement age who choose not to work. There may also sometimes be women who are vulnerable and need a different type of support, so wouldn't be fit enough or healthy enough or well enough to work at that time. But the numbers are high at the moment in terms of the population of Ash House. When the numbers get to 70, it's difficult to find full-time or even part-time employment for everybody. But again, we're looking at how we expand that. We've got a number of ideas for how we can create more opportunities outside of Ash House for women who are suitable to go outside. The infill on the ground floor that we're talking about, which we're currently doing, will provide a number of classrooms, a beauty salon, a hairdressing salon, which provide training places as well as activity. So the vision would be that everybody would have not just something, but something appropriate.
Yeah, and do you work on the principle and accept the principle that purposeful activity is one of the main things that needs to be in place in prisons?
Yes, absolutely.
Okay.
Yeah.
I might have missed a detail on it. In terms of the step-down facility for women, when will that be operational?
By the end of this calendar year, we would expect to have that up and running, so by December.
December, okay. And 6 women at a time?
6, yes. Partly because the design of the house, the 6 bedrooms is about as much as you can build without it starting to feel like an institution, and the hope was that it wouldn't feel like an institution, that it would feel like a small supportive community. There's no reason why we shouldn't look to build a second house if that's successful, and we need 6 more places because they can happen more quickly.
Is that a purpose-built facility?
Yeah.
And is that on site? Where is that actually located? It's on the High Bank site, but it's where the women's prison will be eventually. So it's outside of the perimeter, but on the High Bank site. Okay, so you would consider building another one then?
Yes.
Okay.
Yeah.
Mr. Wells?
I assume the beauty salon is to train prisoners rather than to look after their own appearance?
It's both of those things, actually, because it's primarily as a training facility, because we know that that's a realistic opportunity for women to get employment when they're released. But if we're talking about women building confidence and a sense of well-being... Sorry?
Criminals we're talking about here?
Yes.
Not staff, criminals.
We're talking about prisoners.
Right.
But this is primarily a training opportunity. We're doing it because women can realistically hope to get employment in that field, contribute to the economy, and be less likely to turn to crime and end up back in in the criminal justice system.
I'm showing my age here, but I think the public would react quite badly if prisoners were, spending taxpayers' money to look like Twiggy. That's the only model I can think of. But being serious about it, I mean, it's a deterrent, it's a punishment, as well as a training opportunity.
I think a number of things, Jim. First of all, we haven't invented this idea. We've harvested this idea from other jurisdictions where it genuinely provides women with marketable skills. So we're not doing it because it's a nice thing to do. We're doing it because it's realistic and it provides appropriate training.
I feel an assembly question coming on to the Minister about the cost of all this, but I'll move on. In an oral answer this week, the Minister indicated 155 prisoners a year were brought in for evading TV licences. And you've mentioned earlier that Maghaberry is almost at capacity. And once you brought the average cost of dealing with a prisoner down considerably, no doubt all your savings were gobbled up by legal aid anyhow, but it's good to see that at least one aspect of justice is saving money. What would be the impact if we were to decriminalise all fines and debts in Northern Ireland? Would that relieve the pressure on Maghaberry?
Well, interestingly, we have no fine defaulters in prison at this time. We have two. Sorry, we have. So you will know that the practice of sending fine defaulters to prison has been temporarily suspended, pending changes to the arrangement. So, although we do talk about fine defaulters being a drain on the prison system, they are only ever in fairly small numbers at any one time. So we don't think that would have a huge impact on the population.
Because I'm told that it's not so much the amount of time they spend, but they all have to be processed in and processed out, sometimes within 48 hours.
Yes.
Even less,
yes.
Which is a huge administrative cost.
It is, yeah.
So have we any thoughts, presuming that's something you would welcome in the long term, that you wouldn't have to do that?
Absolutely, yes we would. And we're obviously part of the discussions about new fine collection and enforcement arrangements and supervised activity orders and other disposal. So absolutely we would, because not only is it a drain on administrative resources, as you say, but we have little if no opportunity to do anything with those prisoners in the way of interventions.
It seems a bit archaic that someone can go to prison for watching the Nolan show without a licence. I mean, that's very, very odd punishment. Watching the show is punishment enough. But it still strikes me as archaic that we're still doing that. And that was my only question.
Okay.
Okay, I suppose Mr Wells probably does touch on an issue that the public will talk about, which is prison being punishment vis-a-vis rehabilitation, and I suppose it's how much of this rehabilitation also deals with their offending behaviour and that they're there because they have committed a crime.
Well, absolutely, and David Ford is always clear about this, as are we, that people are sent to prison as punishment, not for punishment. So what we do know is that we have to give the public confidence in the service that we deliver on behalf of society. So we are mindful of the need to demonstrate that we're using public money wisely, and Mr Wells makes that point that we need to be able to be clear what are these training opportunities costing, set against the cost of reoffending, because the cost of reoffending will be significantly more than the cost of giving people training that will equip them to contribute to society. So we need to be absolutely clear that our primary function is to serve the public by building safer communities. That's what we're for, and it's important that everything that we do is framed in that way.
I think I would just add, Chair, that I think the public would expect that we do something with them and seize the opportunity the prison affords to try and challenge and change distorted attitudes and behaviours that cause people to commit offences in the first place. And that's what the interventions and programmes that we are seeking to put together, along with our colleagues in the community and probation, will address.
Mr McGuinness had wanted to last point.
Just a very small point. Just the number of remand prisoners. I know that's a variable, but what sort of levels have you got now?
Well, interestingly, we've done a bit of analysis of the population, which we would hope to be able to share with you when that's completed. The number of remand prisoners has actually gone down against the backdrop of the rise. So it's not a rise in remands. That's not to say there isn't more that we could be doing collectively as a criminal justice system to look at alternatives to remanding people in custody, and we'll be continuing those discussions with probation, with voluntary and community sector organisations who provide bail accommodation, for example.
So there might be a further report on that
Yes.
coming down
Yes.
the line.
Yeah.
Thank you very much, Chairman.
Okay. Well, can I thank Sue and your team for coming along today?
Thank you.
It's maybe been a bit longer than I anticipated, but I think very worthwhile.
No, thank you.
I appreciate it.
Great, thank you.
Thank you.
Crazy. Can you just think about it? Get this thing out here done. All right, I just tweet. Courtesy of the tax.
Tweet.
Whatever. So is this done to the men first? Is it done to the women?
Okay, members, then the report that you got handed out is there. That's the draft report. The formal going through it is at the end of the meeting, subject to any changes members are wanting to get from the draft report. So can I thank at this stage Christine and Marie and the team in the committee office who's been burning the midnight oil to get us to this point since Tuesday's meeting. So there's been a lot of work to try and accurately reflect what everybody committed to the committee and the committee's deliberations. So there's if members have been able to identify anything, now is the time to do it, and then I'll be going through all of the different parts of the report at the end of the meeting. So if members are content with the report that's currently drafted, then what will happen is during the next part of the meeting, the committee will formalise now the executive summary, which you can't do until we had originally considered this aspect of it. And then we will go through it formally and agree then the printing of it at the end of the meeting. So if there's any typos that members have spotted, that will be helpful. And if there's nothing then in terms of substance, we'll allow the committee staff to go ahead and produce the formal report for agreement. Okay, there's no changes needed.
I think, Tom, you were recorded in clause 6 as saying aye somewhere, I thought. And then you changed that, do you remember, at the meeting on Tuesday?
No, well, I didn't change it, and it is recorded in it that I said I wasn't prepared to hold it up, but that I did reserve the right. I didn't support, object or abstain in any of the clauses, but simply that I reserved the right. We reserved the right to bring forward. So I think that's actually recorded in it. There's a check there.
Sure, just maybe for the record, I wasn't present on Tuesday. Just to reiterate, I appreciate that the minute of the meeting is gone through and the record shows what it shows. But had I been present, I would not have been in the position to support Clause 6 as is currently drafted, and feel that the matter needs further consideration and will be addressed, certainly by that party, but further consideration. I think the situation is that research has been commissioned and we should nevertheless take that. That's, I would have just said that on Tuesday anyway. So.
Which
And I've said it previously anyway.
And I think from my reading of the report, that's reflected.
It is.
In the where members have had commentary around Clause 6. So yeah, for the purposes of that meeting, that's fine. Okay, so then members are. There's no amendments needed to what's in front of you, so this will get an executive summary now prepared and formally agreed in the proper procedures at the end of the meeting. Okay? Great. Thanks, Marie.
So much. It's just so cool. Stadium.
Okay. Item 6, access to justice review, the six-month update. And the department wants to come forward. At our meeting on the 27th of March, we considered a written briefing from the department outlining progress on the implementation of access to justice review recommendations. The committee did note that there was some slippage on a number of the projects, and hence the oral session now this afternoon. So can I welcome Mark McGuigan, Deputy Director, John Halliday, and my briefing paper was right.
Yes, twins.
Slight differential in the spelling. Yeah. There's an E. Yeah, okay. It's a bit like Given and Girvan. That's it.
We know the difference, but
if I say something I shouldn't say, no, that was probably Mr. Girvan you're talking about. Well, you're all very welcome to the meeting, and I'll hand over to yourselves at this stage, and then members will have some questions.
Thank you very much, Mr. Chairman, for your introduction and for the opportunity to brief the committee on the progress that we have made against the Departmental Action Plan. I'll keep my introductory comments brief, as you have the written briefing in front of you, and I'm aware that the committee members will probably wish to probe on particular points of interest. Can I start by explaining that the papers you have in front of you, the papers there, and what we're trying to achieve through them. Annex A represents the 6-monthly report in the tabular format that the committee requested. It sets out the various milestones for each of the projects which go to make up the programme. And for each project, it provides a brief comment on the current status and is intended to let the committee know at a glance where we are. On this occasion, I've also provided a more detailed cover note for the committee, which was intended to address some of the issues that the committee had raised with me previously. In particular, in this covering paper, I have sought to provide an overview of the overall progress against the action plan, to provide a preliminary analysis of the savings from changes to criminal legal aid, and to set out the areas that we intend to focus on over the next 12 months or so. In terms of the overall progress, the report flags up the steps that have been taken to reduce the costs in criminal cases through changes in the way in which work is remunerated, with further initiatives currently being planned or taken forward. We have also commenced the first of the reforms to civil legal aid regarding levels of representations which have just been introduced. Work has been carried out on rationalising financial eligibility criteria, and we are developing a new fee structure for civil cases. The research into the legal needs of children and young people is being prepared for publication, and we will shortly put advice to the Minister on the way forward in relation to money damages. We also hope to bring forward a consultation paper dealing with issues regarding the scope of civil legal aid. And of course, the committee will be aware that the Legal Aid and Coroner's Courts Bill has been introduced, and I would like to thank the committee again for their assistance in bringing this area of work forward. At an earlier appearance before the committee, members expressed an interest in a number of areas which I have sought to address in the report. The committee sought clarification of the reduction in the number of cases in which 2 counsel were granted in the Crown Court. Prior to the introduction of the new rules in April 2012, 2 counsel were assigned in some 50% of cases. In the calendar year 2013, 2 counsel were assigned in just 20% of cases, which is precisely on target. The committee also sought further information on very high-cost cases. Before the reforms were introduced for the Crown Court, new VHCC certificates were being granted at the rate of some 5 per month. Most of these cases have worked their way through the system, though there remains a small number where the bills have not yet been received. There are still a number in the magistrates' courts, but provisions for the VHCCs in the magistrates' courts will be removed when we make the amendment rules approved by the committee last year. We have set out in the paper the reduction in the costs of VHCCs in the Crown Court. We are in the process of undertaking a more detailed analysis of the Crown Court costs and would intend to share this with the committee when we present our proposals for further reform after the Easter recess. The committee also queried the legal aid expenditure in 2012-13, that's for criminal legal aid expenditure. A figure of £31 million is quoted in the Legal Service Commission annual report, and I can confirm that this is a technical accounting figure which takes account of provisions which had been made for future expenditure. In that year, there was a particularly large movement in provisions of £19 million. However, page 61 of the annual report and accounts records the actual cash payments in that year of some £50 million for criminal legal aid. The committee also asked for a comparison of costs in Northern Ireland with costs of legal aid in England and Wales. We have not yet included this in the paper as the issues are complex. The legislative framework in each jurisdiction is different, which makes direct comparison problematic. The closest are probably the Crown Court, and we can do a direct comparison of cases that run here and the fees that would have been paid had the fee structure in England and Wales been applied. In fact, that's what we did in our latest Crown Court review and informed the project looking at the Crown Court fees. However, in relation to civil legal aid, the scope is very different between Northern Ireland and England and Wales, where, for example, private family law has been removed from legal aid. We're continuing to look at this to see what useful information could be provided, and I will report further to the committee when we have completed that. Finally, Mr Chairman, I've sought in the paper to set out where we intend to focus our attention and efforts in the next 12 months or so. We have a number of projects underway or at an advanced stage of planning covering a range of issues, and these include the Legal Aid and Coroner's Courts Bill, including the secondary legislation, finalising the current round of adjustments to Crown Court remuneration, completing the development of a new standard fee structure for civil cases across all case types and all court tiers, proposals for changes to funding of money damages cases, a registration scheme for solicitors and counsel, proposals for expert witnesses and the Access to Justice Review Part 2. Looking further ahead, I would anticipate that the future work programme would be informed by progress against the wider action plan, but also the findings and recommendations coming out of the Access to Justice Review Part 2. I hope the committee found the briefing helpful, and I would be happy to take any questions arising.
Mr McCartney.
It's just a number of points. In relation to the expert witnesses, what's that going to precisely entail?
There are a whole range of expert witnesses used in the court system currently to advise in cases, and we are looking at whether or not it would be appropriate to introduce a standard fee or a standardised fee structure for them. There are a number of issues associated with it in terms of the availability of experts in certain areas, and that has introduced a degree of complexity to it. I think one of the other areas that we would like to look at as well is whether or not there's mileage in adopting an approach where you would have a single court-appointed witness who could provide expert testimony in respect of a case rather than having a number, and that's something I would like to explore in the consultation paper.
Okay, and in terms of the legal needs of children and young persons, that report's now ready for publication?
That report's complete. It's with us. It's just going through final check proofs and being prepared to put to the Minister and then for publication.
And we should have had
in the next, after the Easter recess, I guess now.
Okay, and is there any, in terms of the other ones where there's that should have been sort of maybe worked close to be completed or near completed, and they haven't started, is there any particular reason for that?
No, I mean, I think in terms of the things which we aren't taking forward, there's a material in there in relation to the Public Defender Service, for example, where we included that in the consultation paper on the Crown Court fees. It's a huge exercise, and we just simply haven't got the resource to do it at this stage, and that's why we've put it on the long finger. There's a couple of other things. The reform of the Green Form will be informed by looking at the broader scope issues, so we wait until we get to that stage before we commence on that. The on-call duty scheme, we haven't really started work on that yet, and that will be something that we might get to over the summer. And the other thing which was highlighted in the document was the funding code, which we're addressing, as you know, through the Legal Aid and Coroner's Courts Bill, and looking at that in a different way.
And in terms of the exceptional grants,
exceptional grant, we're hoping to come to you in May with that.
And what impact, as it mentioned here, the rechecking of the Lord Chief Justice in terms of inquest, will that have anything to do, any impact on that, or is that not related?
Won't, no.
Not related.
No.
Thank you.
Mr McGuinness.
Thank you very much, and thank you for your report to the committee. Just in relation to alternatives to money damages, how advanced are you in relation to that?
This is a very long-standing piece of work which predates me and many of my predecessors.
I appreciate that.
I'm told when I came to it, I think we're at the stage where we've had significant engagement with both branches of the profession in respect of that, and also with the insurance industry as well. And we are in the final stages of trying to put together a policy paper which will go to the Minister to take final decisions on that. And I would really want to bring that to a conclusion over the next couple of months so that we can bring it to the committee and start to move forward.
You're talking about really the autumn before you'd have something
I would like
well
to
defined.
I would like to try and get back to the committee before the summer recess
Right.
with something at least on that.
It just seems to me, Chair, that it is a crucial area for the vast majority of people out there who engage in law and who wish to have access to justice on the civil side. It's of great importance, and getting an alternative scheme to the current civil legal aid scheme would be very, very important.
And that's what we are trying to do, and that's why we're spending time trying to get that right now, so that when we come to the Minister and to the committee subsequently with proposals, that they are solidly based and firmly based, and will meet the needs going forward.
Yes. Just in relation to discussions with the Law Society and the Bar Council, are there ongoing discussions in relation to other areas, leaving aside the area we've just discussed?
We talk to them all the time. We're engaging with them. John and I, for example, will be engaging with them on the Crown Court fees. Both the Law Society and the Bar. We're engaging with them on the money damages. We are engaging very closely with them on the civil fee remuneration, where we had the consultation last year on a set of proposals. They didn't attract a lot of support, and we are engaging very closely with them to try and develop a scheme which will meet the needs both of the legal aid budget and the professions going forward, and the individuals who are benefiting from that. So there is, and we've had positive and close engagement with both branches of the profession in taking that forward. We've money damages is one, clinical negligence is another. So there are a range of areas that we're engaging with them on an ongoing basis.
And without prejudice, I mean, obviously you'll make your own decision ultimately as a department, but without prejudice to your ultimate right to do that, are those discussions proceeding?
They're in terms of how they're very positive. I mean,
yes.
I don't think that we will ever come to agreement on all aspects of everything that we're talking about. And I think that collectively we recognise the need for reform and for change. And we come to it from different perspectives, obviously. But the discussions are positive, they're engaging, arguments are made and accepted, and I can really characterise that as actually very positive engagement on both sides.
Thank you very much, Chair.
Mr. Elliott.
Chair, thanks. Thank you for that. Just one query, and that's around the tables that there are for the very high cost case, Crown Court costs, and the non-VHCC Crown Court costs. I note your note at the bottom of that where you have said, unfortunately, the figures are skewed by the additional Crown Court judge. You want to indicate that you will carry out further analysis of that, because that is clearly showing us a significant reduction over the last, increase over the last 4 years. But I'm just wondering whether that is a displacement or.
Okay, part of it is displacement, part of it's an increase in volume. There is always going. The cases which had previously been classified as very high cost cases are still coming into the system, but they are remunerated in a different way. So
it's just displacement.
It's not just displacement. They will be remunerated at a lower level in terms of the new fee structure which is in. So there is some increase going into the non-VH, what's called the overall Crown Court costs there in the future years, because some of those cases have moved across. Any case which came in after the new fees were introduced will not be classified as a VHCC, but still needs to be prosecuted through the system, and therefore attracts a fee at a lower level. So some of that increase is down to those cases being remunerated in the standard fee of each.
We've been almost led to believe that very high cost cases have totally disappeared, but this is the first time that I have heard this type of explanation, that they're just going somewhere else.
Well, people will still commit murder and will still have to be prosecuted for that, and their legal representatives will be remunerated, but they'll be remunerated on the standard Crown Court fee system which was introduced, and not under the very high cost case approach.
Okay, you did say you're going to have further analysis of that. When can we expect that further analysis coming back to us?
My intention was to bring it back to the committee when we are coming with the new proposals for Crown Court fees, which I think is in May sometime. We are working. It's quite complex to work out the increases in volume, the reductions which have been delivered through in average cost cases, which have been delivered through the introduction of the new fees, and the overall increases which are a consequence of bringing in the additional Crown Court judge in Belfast, and the throughput through that. So we're trying to get a sophisticated analysis which will help explain where the movements have taken place, where there may have been some displacement of those cases which would previously have been classified as VHCCs but are running through the standard fee structure, and where there are increases in volume.
Will that analysis also give us the difference between what it would have cost through very high cost cases and what it will cost now?
We hadn't planned to do that, but we could look and see whether that could be included.
I think it would be useful if we could at least get an indication, and it would demonstrate where they're.
We'd have to make certain assumptions around that, though, in terms of which cases we would classify as VHCC.
The last VHCC scheme required people to keep records of their hours worked. Now they would have moved over to the standard fee, where you don't have to keep records of your hours worked, so we wouldn't have those records to be able to do that in individual cases.
We might be able to do some sort of a proxy on it, but it would. I'm not sure how reliable it would be. We'll have a look at it when we're doing the analysis, and see whether we could put something in.
It may be very difficult for us to judge how much actual savings that there will be in the system through that process if we don't get some sort of analysis.
Well, I think one of the things we might be able to do would be to look back at the original projections in the business case, and see where that trajectory was taking us if we hadn't made a change to the fees back in 2011.
Okay. Thank you, Chair.
Ms McCorley.
Chair. Thank you, Chair, and thanks for the presentation. Can I just ask about the pilot schemes into the alternative approaches, looking at partnerships with the advice and voluntary sector? What's your assessment of those? Have they been successful?
There's two currently running. There's one with the Law Centre in relation to asylum and immigration and human trafficking. There's another one with housing rights, which provides an in situ court advice for people who come for in the county court for ejectment proceedings and in High Court for if they're getting their houses taken off them. They've been running, the one with the Law Centre is an ongoing contract that has been running for a number of years, and we picked it up and we basically rebranded it and put new objectives in that to it, and the Law Centre have a contract for 2 years which expires at the end of this current financial year. The housing rights scheme has been running for 2 years and is actually proven very, very beneficial to people who turn up on the day who've had no previous engagement with solicitors or advice at all. They're given that, and the judiciary have welcomed it very much, as I say, in the County Court and the High Court. It expired actually on the 31st of March. Housing Rights have asked for a further extension, which we will put to the Minister positively and hope to get that through. We will evaluate both projects at some time during this year just to see exactly what the outcomes for it are. We've got a lot of output data in relation to how many people have used the service, but we need to actually look at the outcomes about sort of the overall impact that has made in relation to not just and legal aid, but the people going through the system.
Okay. So then you can't say for sure if it has been better to have had that in place than not at this stage?
Well, certainly the housing rights one, people wouldn't get that. The legal aid is not available for that service to have representation at ejectment proceedings and repossession proceedings, and that's not what the service is about. It's about giving an additional layer of help. They don't actually stand up and represent them in the court, but it has proven very beneficial, and the judiciary have actually commented on how beneficial it's been about trying to retain people within their homes, which obviously then doesn't have a better impact for social housing and stuff like that. So anecdotally and from numbers actually going through, they have had very good impacts, but we do need to look at that, the overall outcomes of it.
Okay, but certainly in the current climate, things I know are starting to get a bit better, but it would be something that would be good to continue.
And certainly for the housing rights one, we would like to see it more joined up with the work that the DSD would do around benefit or money advice and stuff like that. DSD, I understand, will be going out for a new contract sometime this year, the next 4 years, and we would like to link it in more formally with that, but we obviously have to have those discussions with the
Okay, thank you.
Okay, thank you. No other members, so I thank you all very much for coming to the committee. Thank you. Much appreciated. Okay, then item 7 was an update on prison service corporate governance arrangements, and they were on pages 113 to 117 of your reading folder. And that was discussed when the prison service officials were here. So if members can note it, unless any other comments are needed, then we'll duly note it. And again, we discussed the Prison Review Oversight Group summary report whenever prison service officials were in front of us earlier. And the latest summary report of the Oversight Group is there for members in the meeting folder. So again, if members are content to note it, unless there's any clarification needed, we will duly note it. Item 9 is Office of the Northern Ireland Judicial Appointments Ombudsman, further policy change. Early in 2013, the committee discussed the Department's proposal for the rationalisation of the Office of the Judicial Appointments Ombudsman. We agreed it was content with the Department's preferred option to retain the duties and powers of the Northern Ireland Judicial Appointments Ombudsman and combine the role with that of the proposed Northern Ireland Public Service Ombudsman. Agreement was sought from the Committee of OFM-DFM to include the relevant provisions in its bill, proposed bill to create a public service ombudsman. The committee later agreed at our meeting on the 20th of June last year 2 policy changes to the original proposals. First change would allow the annual report of the Northern Ireland Judicial Appointments Ombudsman to be provided directly to the Assembly, and the second would remove the Department of Justice's role in relation to discretionary qualifications. The Department has now written to advise that during the course of its work with Assembly officials about instructions to Legislative Council, Assembly officials have suggested the Department reconsider a point of detail in its policy relating to the discretionary restrictions that currently apply to the Northern Ireland Judicial Appointments Ombudsman. Assembly officials have now suggested that it ought to be left to the personal judgment of the person appointed as the Northern Ireland Public Service Ombudsman to recuse him or herself from conducting judicial appointment investigations if he or she considered that any past experience as specified was such as to make it inappropriate for him or her to do so. The Department has indicated that it is content to accept the advice received. So it's whether members have any comments to make in respect of that, or we note it. Duly noted. Item 10 is an update on the committee stage of the Legal Aid in Coroners Courts Bill. Second stage, as members know, passed on Tuesday this week. As agreed by the committee, a public media notice inviting written evidence was published on Friday the 4th of April. Letters issued to key stakeholders providing a 3-week consultation period with a closing date of Friday the 25th of April. An electronic bill folder has been set up to assist members in consideration of the bill, which will include the bill and explanatory memorandum, the bill timeline, the written submissions received and relevant Hansards. The electronic bill folder will be updated on a regular basis and members will be notified when updates are available. The Department has provided a copy of its Delegated Powers Memorandum. A copy of the memorandum is at pages 34 to 39 of the table papers. To assist the Committee's consideration of the delegated powers in the bill, the memorandum will be sent to the Assembly Examiner of Statutory Rules, who will be preparing a report to highlight any issues which the Committee may wish to request further information on from the Department of Justice. So if members wish to contact the Committee office if they require hard copies of any of these written submissions, otherwise it will be through the electronic bill folder that this will be collated. The committee also agreed at the meeting on the 13th of March to hold a single oral evidence for key stakeholders, apart from the Department of Justice, who will attend as and when required to provide information. It's proposed that the oral evidence event should take place on Wednesday, the 14th of May, at 2 o'clock. So if members are agreed, we'll send the Delegated Powers Memorandum to the Assembly Examiner of Statutory Rules for his views and note the date for the oral evidence event. Agreed? Correspondence. There's 6 items of correspondence in the meeting folder for the table pack, and I'll draw attention to several of the items. Item 2 in the meeting folder is a response from the Department of Justice to the Committee's request for further information on the number of young people being held in custody and providing an update on the development of services provided by the Rowan Sexual Assault Referral Centre following the oral briefing on reducing avoidable delay and improving services for victims and witnesses on the 13th of March. If members are content to note that information, unless there's any more required, we'll duly note it. Noted. And for correspondence from the Law Centre in response to the Committee's letter of the 10th of March, which outlined the Minister of Justice's intention to adopt a staged approach to tribunal reform, which will result in legislative reforms being taken forward in the next Assembly mandate, and outlining that the Committee agreed that a briefing by the Law Centre on the reform of the tribunal system should be deferred until such time as the proposals for change are available for consideration. The Director of the Law Centre requests the Committee reconsider its decision to defer oral briefing and outlines the process and substantive issues which he believes the Committee should consider. So the request's there, members, it's there for consideration. I'm still of a view if it's not until the next mandate, then that's the appropriate time to hear a briefing. So unless any member disagrees, we'll duly note the letter. Noted. Item 5's.
Perhaps the next time that the department officials will just ask, there must be comment on it, why it's been put off. Like there seems to be, just if we had some rationale for the postponement of it, then that might assist our replies to the Law Centre. Okay.
Okay, well, we can ask the department that.
The next time, I'll just take it.
Okay. Item 5 correspondence was a meeting on the 13th of February. We considered the correspondence from Randox regarding the nature of drug abuse in prisons and the procurement process for the provision of drug testing. Committee agreed to request the views of the Minister on the issues raised and to meet informally with Randox. Informal meeting did take place with representatives on the 24th of February. Randox has now provided additional information following this meeting which analyses responses to recent Assembly questions regarding drug testing in prisons. and a response from the Minister on the issue is due this week. So if members can note the information provided, then we consider further issues raised in the context of the Minister for Justice's response, and we'll also get a copy of the Hansard section which dealt with this matter earlier in the meeting as well, for members to consider at a future meeting. Item 6 is a copy of a press release and report by Sejini on the handling of complaints by the criminal justice system of their inspection recommendations, and we received a copy electronically on the 3rd of April, so if members are content to note that. Item 9 in the table packs, a letter from the Attorney General for England and Wales, Dominic Grieve, responding to the committee's invite to attend a meeting to discuss the On the Runs administrative scheme and letters. The Attorney General advises that he does not think he's in a position to accept the committee's invitation at this stage. He confirms that his office is working to support the independent review established under Lady Justice Hazlitt, and that his first priority is to give this review his full cooperation. The Attorney General believes it's better for the Hazlitt review to be completed before considering the committee's invitation. So that's there for members' information. Given that we're getting some legal advice on the Director of Public Prosecution appearing before this committee, I'm content that we'd also seek their view on our ability to bring the English Attorney General as well, so we can ask them to look at that response and advise the committee of our options. Members are content.
No, I suppose, Chair, it's a matter of staging and timing. At the end of the day, he does say in his letter this review is necessary first step to establishing all the facts. He may feel freer to come and see us after that.
Yeah.
If he wants to.
Item 11's EU Directive on Interpretation and Translation in Criminal Proceedings was adopted in October 2010, and the Home Office and Ministry of Justice advised during the summer that the United Kingdom has decided to opt in, so this will now apply in Northern Ireland. In October 2013, the Department advised the Committee criminal justice agencies has confirmed that current practice means Northern Ireland is largely compliant with the main obligations of this directive. However, a number of amendments are required to court rules and place codes C and H. The Department proposed a two-stage approach to these circulars about requirements to all relevant criminal justice agencies by the 27th October in 2013 when the directive comes into operation. In the Department's view, this would provide sufficient evidence for the Commission to demonstrate compliance with the directive. Formal court rules and pace code amendments would then follow early this year, subject to normal committee scrutiny. The Department has now written to advise on the 7th of April they will commence a 3-week period of consultation on revisions to pace codes of practice C&H and facilitate the implementation of EU Directive 2012-13 on the right to information in criminal proceedings. A written paper on SL1 has been scheduled for consideration by the committee on the 7th of May, following the conclusion of the 3-week consultation period. If members have any comments on correspondence I have not alluded to, feel free to comment now. If not, we'll agree to action as outlined in the pack. Agreed? Okay, let me go back now. Hopefully members have had a chance to peruse the executive summary while I've been going through that. And I need to formally put a series of questions to members. Okay, so in terms of the title page, committee membership, powers, table of contents and list of abbreviations, let me put the question. That the title page, committee membership and powers, table of contents and list of abbreviations stand part of the report. Members agreed? Agreed. Introduction section. If I can refer members to introduction section, it's paragraphs 1 to 9. Are members content that the introduction of paragraphs 1 to 9 stand part of the report? Yeah. Consideration of provisions of the bill, paragraphs 10 to 441.
This would be a quick one. I mean, there could be a coffee there, isn't there, Mr. Chairman?
There is.
Certainly all Ireland references. Are members content that the consideration of evidence at paragraphs 10 to 441 stand part of the report? Agreed?
Good.
Again, let me refer members to paragraphs 442 to 456. Consideration of other proposed provisions section. Are members content that the section on the consideration of other proposed provisions for inclusion in the bill stand part of the report? Agreed? Agreed. Paragraphs 457 to 490, clause by clause consideration section. Are members content that the section on the clause by clause consideration of the bill stand part of the report? Agreed? Agreed. Yep. Are appendices? Are members content that the appendices stand part of the report?
One issue, Mr. Chairman. Did we not agree that the submission by Philip Bradfield to the newsletter?
It's in it. Appendices 6.
Oh, it's separate from it.
Other additional papers considered by the
All
committee.
right, 7 of the paper. Right, I thought it would be on the written submissions.
That's appendices 6.
Okay.
That's it. So are members content that the appendices stand part of the report? Agreed. Are members content that the executive summary stands part of the report? Okay, in terms of the abstract of minutes, members are content that I approve the relevant extract of today's minutes for inclusion in the printed report. Printing of the report. That the Committee for Justice is content for the report on the human trafficking and exploitation, further provisions and support for victims bill to be printed. Agreed?
Yeah.
And if I can get members' agreement to issue an electronic copy of the bill report to all the organisations and individuals who provided evidence to the committee on the bill. Agreed?
Agreed.
Yeah. Okay. That concludes our formal consideration of the bill, and it will now be referred back to the Assembly for its deliberations now that the committee has concluded the committee stage. So, again, let me repeat myself from earlier. Can I thank everybody for taking part in the process of the committee's consideration of the bill. I know it's been a long piece of work, a very detailed piece of work, but nevertheless I think it's been very worthwhile to do it. Let me particularly thank Christine, Marie, the committee staff for the work that they have done for us. It's been a challenge to pull together all of the evidence sessions, the witnesses that have appeared before us, taking us to Sweden, and trying to coordinate us members who need a lot of help and guidance at times. So they've been able to do that very well. And of course, pulling together this report has been no easy project to do, particularly given the deadlines that we've been operating to. So particular thanks to everyone in the committee that have worked very diligently for us to allow us to do our job effectively for the people. So thank you very much. Chairman's business. There's just a couple of items. Yes, there was the Freedom of Information request that had come in with respect to the letters between this committee and the Lord Chief Justice's office around the judicial appointments competition commission process following Judge Desmond Marinen's appearance, and the information officer, standards officers written advising that the Office of the Lord Chief Justice has no objection to the disclosure of the information. A copy of the information to be provided is contained in the tabled pack. So if members are content with the information to be released as part of the FOI request, then it will now be released. Content. Item 2. We got notice this morning about an invite from the Director of Public Prosecutions for members of the committee to attend the formal launch of the Victims and Witness Care Unit. It's on Thursday the 8th of May at 8:45 in the morning in the Ramada Hotel at Shaw's Bridge, and that was circulated in hard copy to members, so if members can check their diaries. It certainly would be worth going to. It was a key plank of one of our recommendations when we carried out the review, and obviously it would be good for members, if they can, be there for that. I think it's pretty significant to mark the occasion of it. Any other business? Then if there's no other business, we are in recess for 2 weeks. When we return on Wednesdays. So our first meeting is on Wednesday the 30th of April. It's at 2 o'clock and we move to room 21.
Mr. Chairman, just to say that I remain on the Health Committee, so I'll be in 2 committees at the same time, so I'll be moving in and out. What I'll probably do is go to Health when it finishes, then come for the next 3 hours here. Yeah.
Well, you can stay on Health if you want.
Would that be good for our health?
It'd be good for health.
Well, I can only legal aid's been discussed.